So yes, so we term all the lung cancers broadly everything that is within the chest. So um, majority of the lung cancers are what we call non-small cell lung cancer. So 85% of lung cancers are non-small cell, and then 15% of lung cancers are called small cell lung cancer. And that is said basically when you look under the microscope, the cells look much smaller in the small cell lung cancer and they look larger in the non-small cell. But it's not just how they look. These two cancers, they behave very, very differently. Before I start talking about how they are treated and how different they are, I would also like to mention that then there are a few other types of lung cancer. So there is a group of cancer which arise within the lung from the lining of the lung. They are called mesothelioma. And then we have also we have a gland in the middle of the chest towards the upper side, upper part of the thorax, which is called the thymus gland, and then cancers can arise from that. So the cancers we deal, as I said, they are non-small cell, 85% and 15% are small cell. Um, Actually, the small cell lung cancers, they are extremely aggressive, and surgery does not have a role to play in the treatment of small cell lung cancer. There are some cases where surgeons might have removed a cancer and that turns out to be small cell, and that might be enough because it might be a very small focus. But routinely for small cell lung cancer, surgery is not considered to be a standard treatment option. So small cell lung cancers are extremely aggressive. They are without treatment, the prognosis, the life expectancy is extremely short. Between it could be few weeks to just a very few months. Uh, but the good thing about small cell lung cancer is that they are highly responsive. So these patients can be treated with chemotherapy, and more recently, one of the immunotherapy drugs is approved to be used along with the chemotherapy in the treatment of incurable small cell lung cancer. Then if the small cell cancer is um, limited and it hasn't spread, then sometimes we can treat these patients with combining chemotherapy along with radiotherapy. And if we can do that, then we can expect between 1 in 4 to 1 in 5 patients even getting cured with chemotherapy radiotherapy treatment. Um, Non-small cell lung cancer, which is 85%, it's slightly less rapidly progressing compared to the small cell. And they are treated again depending on the stage. If it's metastatic, then it's incurable. And often the main basis of treatment are systemic treatments like chemotherapy, radiotherapy, and immunotherapy and biological agents. Um, but if they are more limited, then they can be treated with a curative intent, so which is earlier stage. So generally stage 1 to stage 3A disease can be treated with curative intent. It could be just a single modality like radiotherapy on its own, stereotactic radiotherapy, which is a newer form of giving radiotherapy for very early stage non-small cell lung cancer. And if it's more advanced, then you have to combine different modalities. It could be chemotherapy along with surgery or chemotherapy along with radiotherapy. And more recently, following surgery, patients are also treated with immunotherapy along with chemotherapy as adjuvant treatment. So the treatment is quite complex, um, but there are curative intention treatment, including surgery and radiotherapy, can be used for treatment of early stage non-small cell lung cancer.
So lung cancer symptoms could be quite varied, and it actually depends on if the cancer is just limited to the lung or if it has already spread to other parts of your body. So I'll give you an example. So for example, when the cancer is just limited to the lung, then the most common symptoms that we could get is cough. Sometimes patients could have breathing problems like feeling shortness of breath. or patients could be actually coughing up blood. Generally, the cough is one of the most common symptoms, and it has been going on for quite a few weeks or sometimes even a few months before the cancer is diagnosed. Also, sometimes, even though cancer is limited to the lung, there could be lymph glands which could be putting pressure on some of the central structures within the chest. So, for example, if there's a large lymph node which has been involved with cancer, then the lymph node could be putting pressure on the esophagus, which is the food pipe, so patients could experience some difficulty in swallowing. And then sometimes actually uh, you can get symptoms because the cancer has already spread. So it's a known fact that with lung cancer, where the primary tumor, the main tumor where it has started within the lung could be small, and that may not be giving any symptoms, but the cancer could have already spread to other organs in the body. Like, for example, if patients have uh, secondary cancer or metastasis to the bones, then you could actually present with bone pain or sometimes a fracture in a long bone, like in your arm or in your thigh bones. So that is also quite a common presentation. But we also see, like, if the cancer has, for example, spread to the brain, then a patient might present with headaches, nausea, vomiting, or even somebody could have a seizure. So the other sides where we can see sometimes secondary cancers in the liver could lead to jaundice. So yeah, so depending on which bit of the cancer is advanced or which where it has metastasized to or it has spread to, depending on that the symptoms could vary. So um, often patients actually present to their GP with symptoms like cough or breathing problems. But what we have to realize that very often these kind of symptoms could be because of simple things like a chest infection. So if your symptoms are not resolving, if they are continuing longer than you'd expect with a chest infection, then it's important to think that whether this could be cancer, particularly patients who have got a long history of smoking. They need to be aware that if the cough is not resolving or it's gradually getting worse, then it could be lung cancer. And often the first diagnosis, the first modality how lung cancer is diagnosed is with some kind of radiological imaging. It could be a chest X-ray, or it could be um, other investigations like a CT scan, where the tumor can be visualized. So lung cancer radiological investigations like chest X-ray or a CT scan. Then we have other investigations like PET scan. These investigations help to diagnose lung cancer. Um, Following, actually, if there is an abnormality which is identified on radiological imaging, then um, the biopsy has to be taken. The biopsy, depending on where the tumor is, sometimes you can have a bronchoscopy where a little fiber optic camera is inserted through the airways, through the nose, it goes down to the airway, and the cancer is, we take a biopsy from the cancer and it's diagnosed. Sometimes, if somebody has got large lymph node near the collarbone, then that can be biopsied under ultrasound guidance. And some tumors which are more peripheral near to the chest wall, they can be biopsied using a CT scan. So there are various different modalities how lung cancer can be diagnosed. So um, normally between stage 1 and stage 3, uh, lung cancer can be treated with either single modality or with multiple modalities. So for example, if it's a very early stage, stage 1 or stage 2, early stage 2 disease, then stereotactic radiotherapy or surgery could be the single modality treatment. But if the cancer is more advanced, then you might have to use chemotherapy along with radiotherapy, or sometimes surgery followed by chemotherapy, or even chemoradiotherapy followed by immunotherapy. There are different ways to treat the cancer. If the cancer is more advanced stage, then you often have to offer multimodality treatment. Then there are stage 4 cancer where it's incurable. And if it's incurable, then what we are looking at is treatments like chemotherapy or immunotherapy, or sometimes even a group of drugs we call biological therapy, like um, they are called tyrosine kinase inhibitors. These agents can be used to control and contain the cancer and deal with the symptoms. Palliative radiotherapy is also is a very important modality to treat incurable stage 4 disease. Uh, but generally, surgery has no role in stage 4 disease because it's incurable and surgery is not going to cure the cancer. So, lung cancer is one of the cancers where recent times a lot of development has happened. So, what we are now looking at, not only with lung cancer but other cancers, we call it personalized medicine. So, what we are trying to do, we are trying to look at the cancers at genetic level. So, we look for mutations. So, what that is leading to, we have got very specific systemic treatment, which could be oral or through intravenous treatment, where we are treating the lung cancers as per the mutations they show. What, how this helps is that when you identify a particular mutation, and if there is a treatment which is directed for that particular mutation, generally the outcome is much better. Although majority of these patients could be metastatic or stage 4 disease, when we treat them with targeted therapy or personalized medicine, what we term it broadly, generally the outcome is much better. The cancer can be controlled for a much longer duration, even though we may not be able to cure it. So the recent development is that we are gradually finding out more such targetable mutations, and gradually we are having more new treatments which can be directed for lung cancers with these specific mutations. And generally, we are seeing a much better outcome than what we used to see in the past. So, survival often depends on the stage of the cancer. So, for example, if you have got stage 1 or early stage 2 disease, where we can give stereotactic radiotherapy, it's a very advanced, more modern way of giving high dose radiotherapy to the tumor and the surrounding margin. You could be looking at the cure rate at 5 years around close to 70%. Um, but as the stage progresses, so for example, for stage 3 or 3B, the chances of cure could be nearing around 35, 30, 35%. So the stage has got a lot of bearing on what will be the eventual survival rate. For metastatic lung cancer, we have in the last within the last decade, we have got new treatments, as I mentioned, drugs, which the group of drugs called tyrosine kinase inhibitors, we broadly term them as biological agents. And then we have more recently, we have got uh, immunotherapy treatments. With these treatments, we do often see some patients, although they are incurable, they could go on to live beyond 5 years. Unfortunately, the proportion of patients who go on to do extremely well is small, but with the advent of these newer treatments, the immunotherapy and the biological agents, we often see patients who go beyond 5 years even though they cannot be cured.